Our next guest says the eyes are the window to the soul, and he does windows. Dr. Gold specializes in laser vision correction. He is board certified and an award-winning ophthalmologist. He's also the owner of Liberty Vision, and he's here with his patient, Marcia Passavant, who is a sales information director for a liquor distributor. Nice to have you both here. Doctor, welcome to the show. All right. First off, Dr. Gold, we should mention that if you make an appointment to your office, you take care of just about everything.
Right. I have one assistant who handles the details of surgery, scheduling, and instructing the patients on what they have to do pre and post-op. But as far as who the patients get to see, they see me their first time in, and I'm the one who makes the determination as to whether they can have surgery. I do all the measurements, I do the surgery obviously, and I take care of all the post-op care as well. Unlike many other practices which are sort of like factories.
Sure, it makes sense. Marcia, let's talk a little bit about your situation. What was your vision like before you saw Dr. Gold?
I had worn contacts and or glasses my entire life. Couldn't get up and leave the bedroom without the glasses, couldn't leave the house without the glasses or having my contacts in.
And how long ago did you have the procedure done?
I had my LASIK with Dr. Gold in 2005, which was quite a while ago, but even then I was surprised at how simple the procedure was, how immediate the results were, and I was thrilled as soon as I had it done.
Life-changing? You probably wish you did it sooner.
Absolutely. I went home that night, I was able to watch a movie, and actually when I first woke up from the procedure I was able to see clear across the room. Went home that night, watched a movie without my glasses, and the best was the next morning when I woke up. I could see the alarm clock. I didn't have to find my glasses to go downstairs and get a cup of coffee. To me, that was life-changing.
That's a great feeling. Dr. Gold, talk to me about what you did with Marcia.
Marcia had LASIK.
Okay.
Before I learned that the LASIK flap, can I show with this model?
Please.
The LASIK flap, which we cut in the cornea in LASIK, never completely heals back to the bed of the cornea. And so about 4 years ago, I made a transition and I stopped offering LASIK. I now do Epi-LASIK, and I think we've got some graphics which show the differences between the procedures. In the picture on the left, Epi-LASIK shows that there's no cutting done, and in the picture on the right, LASIK with the flap cut and folded back. So when that flap gets replaced, the healing is never complete. So those patients who have had LASIK, including Marcia, if they get hit in the eye any time for the rest of their life, just wrong, that flap can come loose, and they've got an hour to find me. This graphic shows how I remove the surface cells. Those are called epithelium, and that's why the procedure is called Epi-LASIK. So those cells are removed with this little blunt tip separating device, and the laser then changes the shape of the next layer down instead of deeper in the cornea in LASIK, and then those cells grow back over the next 3 days. And there's no risk of those patients having a flap dislodged for the rest of their lives. Now, having said that, I've only had to reposition 4 flaps ever out of well over 10,000 cases. But it's a danger that I don't want to inflict on anybody anymore.
Sure. Let me ask you who a good candidate would be for Epi-LASIK.
Pretty much anybody who is tired of wearing glasses and or contact lenses can have this procedure as long as they pass the criteria for screening that we do. And we do a number of scans that determine whether the cornea is thick enough, and most are, and whether there are any corneal degenerations in evidence. And anybody whose cornea is too thin or has one of 2 corneal degenerations that show up on the scans should not have the procedure done. I'll do this on anybody over the age of 18 as long as I have proof that their eyes have stopped growing.
Okay.
And the way we do that is we track down their last 3 eye exams. Actually, the youngest person I've ever done it for was 19, and she was a fully grown woman at that time.
Got it. Makes sense. Doctor, we have to mention that you're the only Connecticut ophthalmologist to represent the Better Vision Network. What's that all about?
That's all about Lindsey Vaughn and whether she can ski again. Lindsey Vaughn is the national spokesperson for the Better Vision Network, which is a nationwide group of ophthalmologists that have selected an ophthalmologist from every region. And in Connecticut, it's just me representing the state of Connecticut, and it's an organization that promotes safe laser vision correction.
Very good. And lastly, you always have a discount for Connecticut-style viewers?
Yes. Anybody who calls in and mentions this program receives a $200 per eye discount. And we've also extended that discount to any first responder, cops, firefighters, EMTs, and also to active duty and retired military to honor their service.
Very good. Well, let's put that information up on the screen. If you'd like to contact Dr. Gold and learn a little bit more on Epi-LASIK, you could get a hold of them at Liberty Vision. It's located in Hamden, or visit libertyvision.net, and you could also find Liberty Vision on Facebook. Marcia, thanks so much for sharing your story with us.
Thank you, Teresa.
Dr. Gold, it's always a pleasure to have you here.
Nice to see you again.
All right, stay with us. More Connecticut Style after the break. We'll be right back.